Thank you, Amit, for the opportunity. We had some excellent videos. I wonder if Sudeep ever does any non-brown black cataracts, looking at all his videos. So I'll be also showing some hard lenses. As we know, hypermature cataracts, the nucleus core is very hard. So in a hypermature lens, what we do know is that the cortex reaches a hyperosmotic state, and this is what makes the lens capsule very tense. And this fluid cortex tends to settle in the bottom, or you could just see a complete white reflex. And the nucleus is very hard, and therefore complications are also common because the capsular bag is empty. The challenges would be that you have difficulty in visualizing the rhexis margin. The second is that the rhexis can extend, again for the same reason. And the endonucleus is very dense. So of all the hard lenses, the hardness of a hypermature lens would be the hardest because the fibers are actually packed quite closely. And the nucleus is mobile, so it's very difficult to chop on a hypermature lens. But having said that, that's the only technique possible because the lens is mobile, you can't drench. So which means you can't do a divide and conquer or do a stop and chop. The only way, if you want to fake a hypermature lens, would be a chop technique. And again, for this, because of the hardness, the corneal health is a concern. So as the previous speakers mentioned, a good dispersive viscoelastic is invaluable. The capsule is very thin, very pliable, so which means the chance of PC dent is higher. So just to show, this is typically how difficult it can get. The nucleus tends to tilt, it's a wobbly lens. So the first challenge would be to have a good purchase. How do you get a hold on the nucleus? Once you are able to get a hold, the second challenge is to get that first chop, because the first chop, with the nucleus dense, though it is a much smaller lens, the fibers are so packed that for us to go all the way down and then separate the fibers becomes a challenge. So once you're able to get a hold and do the first job, the rest of it then would be a little more doable. So of course you have to ensure you have a high molecular weight viscoelastic, use sustain for sure. And the settings use high flow and vacuum, and again at a setting where you have a very stable chamber. We do not want to have any kind of surge here. A 45-degree tip, if you use one, would be helpful because that gives you a better cut. And have more of the tip exposed. I'll be showing you in the video as to why that would be useful. And your energy has to be optimal. There's no way you're going to be able to cut these nuclei using less energy. Use the a higher energy as you, and these are probably better. Rather than trying to use lesser energy and doing a procedure for longer, using a higher energy, higher vacuum and getting a good, better grip would be useful. A vertical chop technique, and I agree with Dr. Amit's comment. I would also use the Mohan Rajan's chopper here, the long one. You have two sizes, the longest one 1.75 with a sharp tip, works well as it would for the hard lenses. So this is a case which also has some fibrosis on the anterior capsule. So use a lot of viscoelastic. If possible, you can even do it from the side port, and the actual nucleus density you can see only after you've opened up the capsule. So be very careful about doing a rhexis because you obviously have to have a rhexis if you want to continue with phaco. Otherwise, again, you will just have to convert. That's the best option to go. So to get the first purchase is important. So you can see the tip about 2 millimeters exposed. So you'll have to use energy, go all the way down, and almost the entire tip is covered. So that's the kind of depth you'll have to get a good purchase. So to be able to lollipop this nucleus. So go all the way down, and the nucleus will tend to wobble, but you'll have to continue to deliver the energy. And once you have the purchase, continue to have the vacuum. So you can see it's about 540, 550. 550 is my maximum. But don't release the vacuum until you've actually chopped. So until you've seen that actual separation of the fibers. So hold it down. And then as you're stabilizing it, you'll have to probably repurchase if you lose the hold. And then separate, because the bag is empty, you have space. The bag being empty also means that you can have a PC rent or a dialysis, so you'll have to be aware of it. That's why the chamber stability is so critical. So you want to go with high vacuum and flow, but not to compromise on the fluidics. That's something we'll have to have. The IOP here is set at 60 because this machine permits us to have a target intraocular pressure. But if not, you will have to use your maximum bottle height, so you have that well pressure and you are able to use high parameters in this case. So that's something you'll have to do. The cutting has to be good. If you're using torsional, I use 60 with the balance tip. Otherwise, you can use the post ultrasound if you're using a standard ultrasound. So Like I mentioned, the rexus size, you don't want to make it too small because then you can't bring the pieces out into the AC and phaco. Again, you don't want to make it too large because then the whole nucleus wants to come into the AC and then there's nothing to hold it back. You're too close to the endothelium. So again, this is when you actually see the actual density. So don't be fooled thinking that hypermature lenses, maybe it's white, it's not going to be so hard. Definitely they're all going to be hard. If it is a hypermature catar, that is a given which we have to work with. Take some extra time and do the rexus. And again, have more tip. So retract the sleeve well, have the tip well exposed, and use a new tip. If you, or you have a few tips just kept set aside for these hard lenses. There's no point trying to use a blunt tip, then you won't get that good purchase. And I would like to normally complete the first chop and then go on to the sub chops. So I would actually like to chop it very small, you know, when I do any phaco chop, but in a hypermature lens, you can't do multiple fragments in the first go. So I will be happy if I do either a 4 or 6 piece chop initially, so at least I have those other pieces to support it laterally when you're chopping. All of that helps. Again, the bag is still loose. It's not like it's going to help to hold it in place, but at least you have that amount of lateral some support to do it. So about a 4 or 6 piece chop is important. You obviously have to sub chop it later, but that first chop, but the first separation is important. So once you have chopped them into the pieces, to hold on to these pieces, use the side of your phaco tip, use the side of the fragment that will give you a good hold, and then make it into smaller pieces. So this is what is going to make these fragments malleable. Otherwise, it's going to be very hard and you will have more chatter, especially with some phaco systems. So you will have to ensure that you make it smaller. This way, the absorption is better for your cornea post-op day 1. Again, ahead of time, you will still have some edema in these patients. So tell your patients that you know, your recovery may take a few more days. Use the good viscoelastic. Try to stay at the iris plane. You do not want to go into the anterior chamber, except maybe for the last piece where you're too close and the whole bag is empty and the PC also may be trampling, the zonules are weak. Otherwise, try to stay on the iris plane and step down your parameters for the last piece. Again, it's a higher chance in these. You know, the bags are also very friable, so you would probably want to go with low parameters for your last piece removal. So in conclusion, focus on these steps, have a complete rexus, good protection for the endothelium, use adequate energy, please remember this is so critical. So you'll have to have the sleeve retracted, go deep, get a good purchase, and the lens will flutter, but you will still have to continue to deliver energy, hold on to it, continue to hold vacuum, don't let go of the grip, and then use your chopper, continue to have vacuum. If you lose control, go back, get a purchase, separate until you break the other fibers, and then continue with phaco. Thank you.
Thank you, Dr. Haripriya ma'am.